Felippe, what are the mistakes that jiu-jitsu athletes or jiu-jitsu people are making nowadays with their bodies that they don't even know they're making?
I would say two. One is ego, and the other one would be not be ready to go back to the mats after being injured. Most of the time, people, they just treat pain. They don't retrain muscles, and they think just because they're free of pain, they're ready to go back training.
Stresses that people might be having in their life, not related to sport even, just normal life.
Normal life.
Could be not so much causing the injury, but could be preventing them from recover.
It wasn't easy, it was super stressful. My son was born at the same time that was going for the exams.
Yeah.
I failed, he got sick, we have to stay in the hospital. Then he got sick again because of the virus going to the child care.
Yeah.
It was a very hard, I wasn't sleeping well.
And these mics are already on as well. Everything's on.
Be careful what you say now.
Now
It's
chill.
It's be recorded.
Guys, anything that we record, make sure that anything that we say that could get us in trouble, jail time, be nice, edit out, you know. I don't know. When I start asking questions, we forget we are in a podcast and we talk too much. No, good. But you good? Felippe, wanted to start asking one very important question. What are the mistakes that jiu-jitsu athletes or jiu-jitsu people are making nowadays with their bodies that they don't even know they're making?
I would say two. One is ego. That's the main one, I think. And the other one would be not be ready to go back to the mats after being injured. You know, in terms of most of the time, people, they just treat pain. They don't retrain muscles, and they think just because they're free of pain, they're ready to go back training.
So you're saying that things that people do that I do all the time, that Voltaren, Nurofen / Panadol,
that's it.
Feel good, little move around, jump
Go
in.
back, yeah.
This is one of the biggest mistakes.
Yeah, you don't retrain your muscle. You just pretty much you're pain free, and you're feeling good. But maybe that muscle or that group of muscle, that system is not ready to support all the stress from like the whole training.
And you get injured again.
And you get injured again.
Or you injure something else around that injured, yeah.
Maybe, yeah, compensation or something like that.
But do you find that, for example, that's the approach. A lot of people, when they get hurt, I don't for many years because of my career and because of, treating with you since I was in the very beginning, but a lot of people go to the doctor.
Yeah.
Go to the go to the GP, go to the hospital.
Yeah.
I heard something, I hurt my shoulder, I hurt my knee. And that would be the protocol to these days, no? Like rest, Panadol, get pain-free, and then go and move?
It depends. It depends on what type of injury. So we have culturally in Brazil, what we do, we go straight to the doctors. Mm-hmm. You go for a scan, you wait for the scan, then you get the results, then you start to treat. So what we do nowadays, you go for someone that is specialized on that field, for example, jiu-jitsu or soccer or wherever, and the physio or the person is taking care of you will assess you, and based on that, they will ask for scans or not, and they will start the treatment straight away. So for example, before, we believe that when you have like a muscle tear, you have to rest. Nowadays, we start the protocol from day one,
Already actively trained.
Yeah, we just respect the limits, but being active since the beginning bring better outcomes.
Then resting and then coming back.
Yeah, imagine stay for, let's say, 3 weeks with a brace or something. That's not good, for your body, for your whole system. So.
And for so many times, like we've done that in the past, like go back young days in jiu-jitsu, you got injured. I remember going to the doctor and getting a cast.
Yeah.
Around my knee, keeping my leg in a cast for 3 weeks, not knowing really what happened, or an X-ray is not broken, but put a cast, and then going back, and it's good to know. So for those that don't know yet, I'm here with Felippe Guariglia, physiotherapist, one of our black belt legacy, chiropractor. But before all of this, we were just two young kids training jiu-jitsu, getting smashed on the mats every day. And what the first thing I wanted to know is like, what got you hooked into jiu-jitsu? Because as an intro, I remember I did other martial arts growing up, you know, karate, judo, and I used to be a kid, you know, fighting a lot in the school and things like that. And when I went to jiu-jitsu, it was like I learned the real thing. Okay, this actually works.
Yeah.
And knowing you from when we were kids, you already played soccer really well. You know, you were quite far advanced on that area. And one day you went to jiu-jitsu. What got you hooked?
I don't know. I remember Pedro Baldini. We used to study together and skating, biking together. And he was doing jiu-jitsu at Paulo's gym.
Extreme Jiu-Jitsu.
Extreme Jiu-Jitsu. And one day he just, hey Felipe, let's go with me. Now you go today and okay, let's try. And since then I thought, oh man, it was so interesting to, you know, put a gi. I never had a gi, never used a gi or never did any martial arts before. So I went there and I was very, not like shocked, but you know, excited with the whole environment, the mats, everyone wearing gi, all like kind of same age. We're like pretty much
a lot of teenagers back in the day.
A lot of teenagers, yeah. We were like in, I don't know, 20, 30, I can't remember exactly, but it was a bunch of people at the same age.
Yeah, I remember a photo from that time. That in one picture we had about 50, I think it was 50 to 60 people, like all that group of high school kids.
Yeah.
Training full time, Monday to Friday, no stopping.
It was very intense. And one of the interesting things, that time we didn't have money to buy gis. I used to have just one.
Me too.
And we didn't wash for the whole week and just wash at the end of on the weekend.
Yeah.
Just because we don't want to stop training.
Exactly. And you hang it, you get home, you hang it, so it dries.
Yeah.
And he's ready for next day.
That's it.
And interesting thing as well, no ringworm, no staph infection.
Nothing.
Didn't exist.
Didn't exist at all.
You know, we were clean kids maybe, I don't know.
I don't know.
But
the bacteria didn't
the bacteria wasn't born yet.
Us, yeah.
Because one interesting thing as well is like at the time, you know, the way we train, and we always go back to this old school jiu-jitsu and all that, but it was brutal. I remember our warm-up sometimes was 45 minutes of climbing ropes, sit-ups, push-ups, and just doing like military training. And then after you are like half broken, super tired, then we will learn the technique.
Yeah.
And then train. Training will go for a minimum hour and a half. I think average hour and a half. Sometimes we could have 2-hour sessions. But compared to how we train today, you know, like do you think we just train like what we call tough training was better, or just was a bit more stupid at the time the way we trained?
I think the warm up was good. I think
this was a conditioning session.
Pretty much, and I think was important at that time because as a young adolescents, we didn't used to go to the gym, for example. You know, some people they don't have time to go to the gym even nowadays. You do jiu-jitsu and that's it. You know, gym is super important. That's one of the mistakes that I made throughout my whole life, not be consistent to weights, to protect myself, to make myself
to keep the body strong.
Yeah, pretty much. So I think that time with that configuration help us to be stronger. You know, protect ourselves. Maybe cardio wise was good as well. As I think just the structure was not very well structured as today. In terms of technique, the sequence, the whole schedule of the sequence, you know.
How we learned jiu-jitsu was not so, it was like, it was very random. Every day you come in, the instructor.
There's a triangle, the other day it's going to be.
Take down.
Yeah, it's not connected. So that's
So we are more structured in terms of how we deliver jiu-jitsu nowadays. But I think because everything is a bit shorter today, right?
True.
Since, F45, and
Yeah.
no one is willing anymore to put 2 or 3 hours in a
Yeah.
training session.
Yeah.
When I speak with Gordon at the gym, he often tells me that his training sessions in judo used to go for 3 hours.
Yeah.
I remember when we started, it was like 2 hours going down to an hour and a half.
Yeah.
And nowadays, if you try to keep people in one session more than an hour, unless they are professionals in the sport,
Yeah, they
even
just,
then people don't do it. People
Yeah,
just,
yeah.
people train at lunchtime, which
Yeah.
they arrive 5 minutes late and they got to leave sometimes 5 minutes early, and you got to deliver in that time.
Yeah.
That could probably have affected, if we try, because I remember the way I used to run classes. I think I ran for maybe a year or two more than I should classes with that very long structure, because I started having people, giving me feedback. Look, it's,
Too long.
too long.
Yeah.
Too long. It's a seminar, it's a workshop.
Yeah.
But I see the point. In terms of our bodies, it would be better if we could put the time
Yeah.
and do the whole.
Especially over, let's say, 35, 40s, So we need a little bit more time to warm up. Especially if you've been training, for example, myself. I've got many injuries, very serious injury. My lower back, my neck, had to stay out of the mats for first time 9 months because of my neck, then plus 9 or almost like a year because of my lower back. I have to warm up well, and sometimes it takes time to warm up, especially when it's cold. We have to. It would be good to have like a superpower sauna. You go in 3 minutes.
Warm up.
The the cold chamber.
Yeah.
That you go for 1 to 2 minutes.
Yeah,
You
yeah,
create
yeah.
something for heat.
Yeah.
So you go in.
Infrared superpower.
Superpower. You go there. You warm up
Yeah.
your whole body. Boom. You at least you like full of blood.
You cooked from the inside
much,
going to
pretty
training.
much.
Well,
So, we can do that with weights. Do some warm up with weights. That's very good. I felt very good. You just get the bar, do some movements, and
Some full body movement and get into it.
Yeah, and you feel the pump.
Yeah.
So
And going back, for example, on the very beginning, was there a moment when you were just training jiu-jitsu, and that you decided, or that you saw the possibility of treating people, treating bodies? Is there a correlation between your training and the things you were doing and deciding to go towards treating people, or it's not related? It was a different thing that got you there?
I think it's kind of related. As soon as we start jiu-jitsu, I got a AC joint injury. It's a shoulder injury that I had to go to the physio, and I like the environment. I was very curious about how do we do to treat people when they injured. I was like 15, 16. It was my first injury that I had to take care of it. And then I was at school, and one of my colleagues, she took a book with the whole professions. Lawyer, engineering.
Yeah, the vocational books.
Vocational books. And there's the section of health, the health section. And I start to check, start to read and open all the pages and everything. And we've got the doctors interesting, but I don't want to open anyone. And then came the physical educators in Brazil, that we have the personal trainers here, or exercise physiologists, or
PE teachers.
PT, and interesting, but I want something in between. And then I saw the physio, and back then we had Ronaldo Nazario. He got injured, and we have Filé as a physiotherapist.
That made physiotherapists famous.
Yeah. So at that time, Felipe, that's what I want. That's in between both, that you have to have a little bit of knowledge from one side, and the other side, one exercise prescription, or the other one is diagnosis. So you get all of that. You don't open people, and you just don't do, how can I describe, not just exercise, but you get in between.
You train people, but you're fixing them at the same time.
That's it.
Yeah.
So that's what I want. So I was at the age of 16.
That's when you decided?
Yeah. And from that...
Because for most of us, like, I was getting injured all the time from the same time as you start getting injured. But I remember I grew to just complain.
Yeah.
I was just mad that I was injured, you know, and I wanted a fix.
Yeah.
And I didn't care where the fix will come from. I said, man, give me a tablet, a pill, you know, an anti-inflammatory, a painkiller, as long as I could go next day and do the same dumb thing that I did the day before and get injured again.
Good. Yeah.
So you went 180 degrees to the other side and thought, actually, I want to understand how people are getting injured.
Yeah.
And help fix.
Yeah.
And fortunately for us, you were fixing. You've been fixing me since I think for over 20 years. Since, you know, all the time I've been broke, which has been actually many. But in a way, it's a selfless way because you can fix everybody but you. I see often you. I go see you, you know, at my recovery or I see you at the gym and you are there like pulling your neck to the side. You know, you're like, oh, my back is broken.
Yeah.
And then how does that come about to you? Because you have all the knowledge that you apply on everyone and all of us.
Yeah.
But you cannot apply it to yourself.
Maybe because I work a lot, there's no excuses.
Yeah.
You know?
No, but it's hard for you to apply on yourself, right?
I know what I should do. You know, I should do more like maybe a little bit more mobility, weights, and create a better routine. But I think I like to treat so much that I put all my time to treating people.
Yeah.
You know, for me it's good because I do what I love, but at the same time, for me it's just like a chess every day. So there's a new people, I want to understand what's going on, classify what type of injury, and from there we can plan. So I get so excited to do that every day that sometimes instead block my agenda to work out or do something. You know what? I'm gonna put one more there. For me, it's a challenge. It's not just about the money. I remember one time I went to Santa Maria. Went for a course there to teach a course there. And we taught the course there. Then I went back to Porto Alegre and I got an email from a guy who did the course with us. And Felippe, we love the course, was amazing. And we like the style and everything. And I want to do what you do because probably you make a good money. And I said to him, man, it's not about the money. It's about being good in what you do and the money will come. You know, automatically. Of course, it takes time to build that experience, that knowledge, and I'm still building. It's when you get your black belt, you just finish the uni. You know, from that's when you're gonna start it.
You gotta hold a black belt around yourself, yeah.
So, being graduated, I still doing courses. I still doing online courses and getting in touch with friends from Brazil that I trust a lot. So, we're not AI. You know, you use AI nowadays to improve our knowledge, to get more answers, to help us, but you have to brainstorm. What the problem is not just the tissue. The problem is we have a brain. Treat a ligament, treat a disc issue, treat a whatever injury. It's easy. The problem is we have a brain that processes all the information, has some beliefs. We have a bunch of problems, psychosocial problems that impact directly to the injury. For example, we have a comp in 3 months, you got injured. You get stressed because of that, because we have like a timeline to
And
follow.
does that affect your treatment and your recovery?
Totally. It's very interesting. Before, remember, that's psychological.
Yeah.
You know, that's your mind is playing that. So we know that type of thing nowadays affect a lot. For example, I got a lot of people with back pain. That's my expertise. So we know that Australia, it's an amazing place to live. There's a lot of people, they want to stay here. Sponsor, visas. It's a very stressful situation that everyone
goes through it trying to move into a new country. Yeah.
Exactly. When you treat people and you can tell they're not getting better, there's something else.
So you're saying that stresses that people might be having in their life, not related to sport even, just normal life, could be not only not so much causing the injury, but could be preventing them from recover. Let's say their body is not allocating enough resources to recover that because it's in collapse with something else.
The way that we process information in our brain doesn't separate what it goes to the stomach, what it goes to your knee. It goes to everywhere. You
Right.
know, it's a
To whatever is
signal.
needed the most.
Exactly. So it's a signal. So when you stress, especially talking about more like back pain, and you don't get better, and you start to go deeply on people's life, that we have to understand what's going on. So
you're a psychologist as well by default.
kind of,
Yeah.
yeah. Because you have to understand, I'm not gonna deal with people's problem, but maybe I can refer to a psychologist.
Yeah.
You know, someone that is more like
Yeah.
knowledgeable to that.
Or at least make them aware of, like, look,
Totally.
you know, like your injury is
It's
this
like
great,
this
but
part-
but the stress is holding you back. So
Yeah, yeah.
get rid of the stress somehow.
Yeah, I've been treating few people now that they're not evolving well, and we know the stress part, it's taking over the injury. You know, they stress because of business, or they stress because of visas. They're not happy
Life,
with
yeah.
work. You know, and that end up like getting them in a certain stage that they can't reset, they can't sleep well. Sleeping is nowadays one of the most important things to recover. We have compression boots, we have sauna, we have this and that, but if you don't sleep well, maybe you're not gonna recover fully. You
Yeah.
know? So you know, when you sleep well, you get fresh.
Yeah.
That day it's very good. When you don't sleep well, wake up during the night and, you know, tossing and turning because of injuries as well. So that's why it's important to treat, make you sleep well, treat, and the cycle is
So it's the cycle that will get you. Because one thing you said before about you know, the stress of, let's, you know, bring into jiu-jitsu, but that applies on everything in life. Preparing for a tournament, preparing for a jiu-jitsu tournament, for example. Quite often, many times that I've been preparing, I would say majority of the times, especially when I was preparing more seriously, you know, like in my competitor career, I would get injured. I would injure
Would happen,
something,
yeah.
you know. Of course, after years of getting injured, I will know like who to go to. Often I'll go to you in the early stages and we will work through it. And that, like I said, that often happened preparing for a tournament. But psychologically, the way I always worked, and of course, the stress of preparing for the event will have an effect. But I've always had this mentality, coming close to the comp, you know, I'm so worried about the injury that and so many times when I got to the actual day or to the moment of competing, because of I think the adrenaline, I think your brain plays the other side as well. All right,
Yeah.
we tried to stop this guy for doing something that will hurt him even more.
Yeah.
He didn't listen. So now let's back him up because we are going into this war. And I feel that when it will come to the competition day or to the day before, I will kind of feel better and I will perform.
Yeah.
And sometimes after the comp, the injury wouldn't come back as bad. Of course, I was treating all the way through it.
Yeah.
But do you feel that this, connecting to what you said, it is a reaction of your brain connecting to your body in terms of,
Yeah.
do you think your brain's trying to prevent your body from doing things that would hurt even more?
I think so. It depends. For example, before we used to have, when you decide to go for a physio, for example, or for a chiro or whatever, when you're injured, nowadays we have a preventive approach. So instead you go when you're injured, you go when we set a plan. So we have like sessions every week or sessions every fortnight or every 3 weeks. So you prepare yourself and that supports your body to train better, to not avoid injuries, but we're on top. When the comp is there, you prepare. Your body is like ready and your mind is ready for the war. That brings like I think the estimate to support yourself very well.
The adrenaline fact, yeah.
That's it. So I think that day, it doesn't matter if you're injured, if you really want that, you're gonna find a way to your body shuts down like a part that is taking care of the injury,
Yeah.
and you just go.
And you just go.
So brain, it's very tricky.
Yeah.
It's very hard to.
Yeah, I think what I've read many times is that the brain wants to protect you. Your brain doesn't want you to do anything
Yeah.
that will put your
Yeah.
body or any part of
In
you in harm
stress, yeah.
or in stress.
Yeah.
But then when you have the stress, your body doesn't recover and all of that. Because I remember, for example, situations in my treatment, as you mentioned, like I've always, for many years in the early days, I had, among all my injuries, back pain, especially lower back pain. I think my early days, I used to get injured a lot more in my early days of jiu-jitsu than later on. And I don't know if I was, because I was, let's say, my young self, I was more mobile. Maybe I took more risk, but I also had less experience. Now my older self, I'm more stiff, I'm less malleable.
Yeah.
I take less risk, and I have more experience. What part you find between the young practitioners of jiu-jitsu versus the older people in jiu-jitsu? I'm saying someone like me that's been practicing for many years. Is there an explanation why I get injured less now? As my body is more broken now, but I get injured significantly less than when I was in my 20s.
Experience.
Yeah.
Maybe you don't put yourself in certain situations that you would put before. You know way more techniques to prevent that. I think experience help us for me as well. For me nowadays, I know that I cannot get stacked, for example. I don't let people grab my neck most of the time if I can prevent that. So my framing, it's way better nowadays. The heaviness of my hips, it's way more nowadays than before. Or if I get feeling that I'm getting trouble in certain positions, I try to recover for a better position, even if I have to reset the whole game that I'm applying at the moment. I prevent myself to not get injured, then have like a big ego to attack and invest in that position.
So go too much into risk all the time.
Yes.
Yeah.
It's like futsal. Futsal, we have the 8 figure that we restart when we're in trouble, for example. So you restart the game and you start to go around.
To circulate the ball on an 8 figure to reset your game. Yeah.
That's what I do. And maybe that's what we do now being a black belt, that maybe you don't get that much experience and you just go, you just attack and like, you're full of energy, on your 20s, you're full of energy, you sleep well, maybe you drink a Coke and eat some bread with butter and
it gives you energy, yeah.
That's it, and you're good. Remember, we used to...
Your body metabolize anything.
Anything.
Yeah,
so
that's
good.
good.
You don't need to eat much or this and that, you just go and you're fresh.
Yeah.
Nowadays, we have to sleep well. So maybe the approach that we're taking nowadays, it's way better than before because of researches, because of knowledge of a bunch of people that have been studying and athletes and everything and methodologists. They are applying now for the young generation. That's why they mini samurais.
Yeah.
So kids with 14 nowadays, they're not black belts because they
don't have the age for it. Because there's a minimum age to achieve that.
And maybe they don't have the strength enough.
Yeah.
But they already.
But there are 16 blue belts beating black belts in super fight events, black belt world champions. So there's no limit now on how young you can get good and physically prepared, right?
That's it.
I have an interesting one. I remember one time, because I've always, went to you for my injuries. And I remember one of the times that I had my lower back, I had arrived in Brazil. I think that was 2015, and I was in a camp to go compete the European at the end of January. I believe that was then. And I arrived, and my back went. I did a couple of sessions. I think maybe the jet lag, arriving in Brazil and training, my back went. And I couldn't move. I was completely, taking a step was horrible. And I remember I called you back then. You still had your clinic back in Brazil, and I called you and I said, Felippe, man, and you need to see me. I don't know what to do. And I think there was maybe it was over the weekend or next day you could see me, and you started giving me some exercises. You told me, over the phone, you said, I'll lay on the floor, arch your back. Does it hurt? I said, yeah, okay, do 15 of those. On the phone, do 15 of those. Have a break, do 15 more. Test it. Does it hurt? I was like, oh, yeah, it does. Which side? Oh, the left. Okay, tilt your body slightly to the left. Do another 15, another 15, another 15. How does it feel? I said, oh, yeah, I can feel it's there, but... And you told me, like, oh, do this for the next 2 days and then come see me.
Yeah.
By the time I got to see you, I was like 60% better. Like, where does that come from?
What's that?
What's that? Because you didn't see me, you didn't touch me, you didn't look at me. It
Yeah.
was not even a video call. It was like a
phone
voice call, a voice
Yeah,
call.
yeah.
And how does that happen? How was that magic?
That was a MDT approach, mechanical diagnosis and therapy, that I did my certification back in Brazil. So it was a very interesting approach. It's a sub-classification system that based on people's movement, you can understand what's going on and if we're gonna help soon the problem. For example, in your case, I could classify that you would respond in extension with a little bit of shift, because probably the straight extension was squeezing, was irritating. So we need a little bit of shift to the side. So to squeeze a little bit more, create a little bit more space there, or closing the space actually.
Mm-hmm.
So then we could stop irritating that bad tissue.
That was what, like a bulging disc or something?
Wherever that was
Yeah.
compressing or irritating that. And by then we just need a little bit of time and exercise and movement to reduce the irritation and for you to be able to move better, you know? So we disarm the system pretty much by using that.
Mm-hmm.
So it's a very interesting approach. That's the approach that I use nowadays since then to classify people to maybe get better results or understand the behavior of the problem. For example, there's a bunch of people that they have shoulder problem. 50% of the shoulder problem is not shoulder, it's coming from the neck, 45%, and with no neck pain. But when you start to test, when you start to check the range of motion, there's a little bit of restriction, or if they don't have restriction, you start to move and you start to reproduce the pain on your shoulder. And that, when we diagnose that the pain is coming from your neck. So based on that, we stop treating the shoulder and it goes straight to the neck. But before that, we have to test. Because if I send you to an MRI or for a scan or wherever exam, at this stage with 40-something years, there's a bunch of injuries there.
So you're saying that if I had a shoulder injury that is not actually a shoulder injury, it's a neck injury, but I go for a scan, because of how much I've been wrecking my body over the years, my shoulder will show some injury as well.
Totally.
Which is, I can treat that, and it's not what's gonna take my pain away.
If that's why I'm not saying that you don't have shoulder issue. What
Yeah.
I'm saying, we have to rule out neck first.
Right.
We have to.
Yeah.
That's mandatory, because what the study showed is 45% of people who were feeling shoulder pain was coming from the neck.
Mm-hmm.
What happens if you just treat the shoulder and
Yeah.
you don't rule out the neck?
Then you end up with the pain forever.
Maybe not forever, but time will help, but it's gonna take longer.
Yeah.
You know, what we do nowadays, we try to anticipate the results. We try to understand the behavior. We try to test first, make sure that the pain is coming from that specific area, and then treat the area. You know, so hip pain, it's a big issue. Gluteal pain, it's a big issue. Most of the time, it's coming from the lower back. But I feel a little bit my lower back, but the strongest pain, it's in my hip. When we start to assess and treat them, maybe using that approach, going backwards or sometimes going flexion, sometimes we flex and we rotate. It doesn't matter the direction, we have to find the direction. The pain start to get less and less and less, sometimes disappears, or sometimes start to centralize, going to the spine. And if it goes to the spine, awesome.
You know, it's the back.
We know it's the back.
Right.
You know? So I've got quite a few cases that Achilles tendon inflammation. The person was getting treated for 8 months. Acupuncture, physio, went to Cairo. And when I start to assess the person, very interesting case, Felippe, I can't walk. But sometimes I'm good, sometimes I'm not good. That's not the behavior of the tendon.
Mm-hmm.
Most of the time, tendon is a consistent presentation. When you step, it's painful. And then you step again, it's painful. Maybe get less painful, but it's always painful.
Mm-hmm.
You know? But sometimes when I'm driving, the pain disappears and then comes back again. That's not the behavior of the tendon. That's the behavior of back. And then show me some movements. Then we start to apply some extensions, side bending. Oh, my Achilles. That's not coming from your Achilles, it's coming from your back. And then we start to treat the back. 3 or 4 sessions, the pain gone. First phase, the reset phase. Then we have the second phase. Rebuild the muscle activation. Rebuild the strengthening.
Mm-hmm.
That's where most people, they fail.
Because the pain is gone.
Pain is gone.
Life is good.
Life is good.
Save my time, save my money, go back to what I was doing.
That's it. So then when the pain comes back,
Yeah.
and keep coming back,
Yeah.
you know, because you don't do what you have to do. Retrain your muscles, get ready for it, you know, build tolerance. We have to build tolerance. It doesn't come over time,
Mm-hmm.
you know, overnight. It comes like over time. So you have to, it comes like, sometimes it takes 3 months to get back to a good strength, you know. Sometimes takes up to a year to solve like a very bad back problem.
Mm-hmm.
It takes time.
Yeah.
What we want to do, we want to go back training because it's the good thing about jiu-jitsu community.
Yeah.
Training, it's good. You know, you for example, there's a bunch of people, they like to run, and they forget all their problems. If I go running, I'm thinking about work.
Yeah.
You know, that's Felipe. When I go to jiu-jitsu, I need to be aware of what you're gonna do, so then
Yeah.
I can prepare myself and be one step ahead.
Yeah.
There's no way to think about John's shoulder or you know.
They say it's the best form of meditation, right? Because to bring you one of the things that we have the most trouble nowadays, you know, is to practice mindfulness as they talk.
Yeah.
But people from our generation, let's say when we were on the bus to school, there was no phone, there was nothing to do. You're practicing mindfulness the whole time. You're sitting
looking
there,
around
looking to the birds, looking
Yeah.
outside, looking wherever you are.
Yeah.
And what we find now is it's so difficult to get things that bring us to the present moment.
Yeah.
And there's nothing that can bring you more into the present moment than someone trying to twist your arms, choke you, throw you on the ground. You have to be hyper focused in that one moment. No, so
Yeah.
I get that. And one thing on what you said before, like so now, with myo recovery and the work you do, you treat a lot of normal people, like you said, with the stresses of life.
Yeah.
But you do treat a lot of athletes or a lot of at least practitioners of lots of sports. A lot of sports people come to you.
Yeah.
And going more to jiu-jitsu, what do you think are the 3 main injuries that we have in jiu-jitsu? And sometimes and how do we go about it? Just before you answer, I remember a while ago when we were running the Wim to Warrior program, which
Yeah.
was now they call the Alta program, which is 20 weeks, people come and train and they fight in the cage at the end. They're complete beginners. And I remember you were assessing them and treating them closely at the time. And you came to us, to Mick and myself, and you did this diagnosis of most of them will hurt the ribs. With the ribs, and I think there was a shoulder as well,
Yeah,
or a collarbone
yeah.
or something. Most of them will hurt themselves in the first 4 to 6
Yeah.
weeks, and that was a pattern. So
Yeah.
you already were guiding us on how to prevent that. But in jiu-jitsu, do you have that? What are the 3 main injuries? And
We can separate. Well, there's the classical injuries, that is knee, shoulder, and back. So back, we can separate lower back being the 3rd and neck being the 4th. So those are the main areas affected by jiu-jitsu. But we have like from fingers.
And are any of them preventable?
It's hard to say. It's I don't think they're preventable. I think if you like do weights, be stronger, and we have more chance to maybe hold the positions, maybe prepare your body. If you get injured, it's not that bad, but it's hard because it's the leverage, it's the position. Sometimes it's not like being choked or you're passing someone's guard and your foot got trapped somewhere and you twist.
Yeah.
How are you gonna prevent that?
Knee and stuff. There's no
shoulder.
yeah.
But sometimes you framing and the guy just hit your elbow, your shoulder go across to your face and they drop the weight on it. It's quick. There's no way to prevent. You
Yeah.
know? So I think being strong, being mobile, understand your body. Mobility is something that as soon as we get injured, we don't treat properly, we don't realize how much we get locked in certain angles.
Mm-hmm.
Maybe that's a important angle that you have to be free to not hurt at the first degrees of movement.
Mm-hmm.
You know what I mean? For example, if you have like people who do shoulder reconstruction, they have lack of external rotation. You know, that's good for them in certain ways, but they tap earlier instead being super mobile. It's just an example. If you don't treat like a normal injury, you got injured. All the muscles, they start to compensate, they got tight, and then you go back, took some pills, feeling good, no pain, go back. It doesn't mean that you have full range. So that range that is restricted probably will put in trouble,
There or somewhere else.
you know?
Yeah. So when you're training, for example, as a competitor, because at Legacy, we train, let's say, a great majority of hobbyists, normal people,
Yeah.
and we also train competitors.
Yeah.
But more and more, I start thinking that we should train them different. First, I started thinking we should train them differently. Now I think we should train them very differently.
Yeah.
But in your view, should hobbyists approach? Because if you're a hobbyist, the way you look at jiu-jitsu, you look at high-level competitors, what they do, how they train, how they perform, how they apply techniques. So, for example, someone training nowadays, they will look, Ruotolo, Andrew Tackett, Mika Galvão. They will look what they do, how they perform, and that's the biggest inspiration. These guys are showcasing jiu-jitsu. Should hobbyists not be smart, but approach jiu-jitsu in a different way to competitors?
Well, the difference between being professional and being amateur, it's you've been paid for that, and you just do that. Hobbies, they most of the time they work throughout the day. They go to jiu-jitsu in the middle of the day or the end of the day. They do their weights. It's hard to, professional people, they wake up early in the morning, have their breakfast or they fasting, they go training, then they train again, they rest. They eat, they sleep a little bit, then they go back training. So they have the whole
They
routine.
recover and treat themselves in between.
Exactly.
They have someone looking at them. Yeah, true.
So let's call normal people, not professionals. We wake up, we work. If it's
Family, kids,
sometimes
sick, not sick.
that's the answer. So it's different. Maybe you can mirror yourself on their techniques, but not the way that they live. Not the way they set up their day. It's
Yes, and then connecting to this, but let's say most of us or most people, that start a sport earlier, and then comes the multidiscipline. Like I said, I did so many other sports. I used to compete in tennis, basketball, skateboard, and martial arts, and then I got into jiu-jitsu, and jiu-jitsu turned out to be the one thing that I followed for my whole life. Became my main discipline, sport, career, work. You played soccer and did other things, and then jiu-jitsu. But we have a lot of jiu-jitsu grew so much, and we have a lot of people starting jiu-jitsu later in life. Let's say in their 30s.
Yeah.
And how do you see what approach or what different approach you think someone starting jiu-jitsu in their 30s or later? Because I have a lot of people that come to me like in their 40s, 50s nowadays. Oh, I would love to do jiu-jitsu, but it's too hard on the body. I'm scared I could get injured. Do you believe jiu-jitsu is also for people later? People can start jiu-jitsu later in life, and how should they approach if starting in their 30s or 40s or 50s?
I think jiu-jitsu, it doesn't matter the age. If they have to go there and enjoy the training. Once they enjoy the training, they don't care about the injuries. You know,
Mm-hmm.
the injuries, they will come. That's fact. I remember we've got a couple training with us at the very beginning, and they were afraid to get injured. For guys, if you enjoy jiu-jitsu, injuries, they will come, and you guys will
Embrace it.
overcome. You know, but if you get stress of being injured more than like to train jiu-jitsu, then probably you guys gonna quit. And they end up like staying, Wally and Amanda.
Yeah.
They were afraid to get injured at the beginning, and man, they love jiu-jitsu nowadays. They got their brown belt, purple belt. They kept training. They love training.
They live and breathe. They travel hours sometimes to come down train with us.
So I have one white belt now that I've been treating, and he's enjoying so much because his kids, they training, and he started to train because of the kids, and he's getting injured. White belt, over 40s. Yeah, we use strength a lot at the very beginning.
That's what we have.
Yeah, so you don't know what to do. You use what you have. So that's pretty normal at the beginning. Remember back then when we started, adolescents, using a lot of strength. We don't know what to do. Always sore, neck sore. I remember the first time that I did neck exercise. I remember we used to do. I can't remember.
A lot of repetitions.
Man, the first day that I did that, and I was taking the bus to go back home, I couldn't hold my neck. I had to
Touch your head somewhere.
touch somewhere because my neck was very fatigued, and that's a process, you know. So, getting the answer from the your question is you're gonna get injured at the beginning. Maybe could be like just some niggles, or some people they get a very sore neck, very sore shoulder. If they can overcome that and kept training, they will keep training.
Yeah.
You know, I think that's
So you just gotta embrace your body adapting to jiu-jitsu,
that's it.
or
jiu-jitsu. It's a little
playing
bit rough.
tennis, or
Yeah.
doing whatever you're doing, bike riding. You're
That's
just
it.
gonna have to adapt. Your body has to adapt to whatever you're doing.
You need to give a little bit of time. Maybe prepare yourself doing some weight training, and mobility is super important because the older we get, the rigid we get, stiff. Understand that mobility is important. A little bit of mobility, a little bit of weight training, and then jiu-jitsu. I think there's no magic recipe.
Yeah,
You know?
that's great.
Yeah.
And one thing, because I mentioned before, now that with me and everyone from Legacy, and I believe for a lot of other jiu-jitsu gyms around and other sports, we come to you at My Recovery. But going back in time, there was a big personal transition that I find, and I wanted to see how much jiu-jitsu has an effect on that. Most of the people that know you from here, from Australia, don't know, like that back in Brazil. Like I came to Australia very young, so I was just halfway through university. I wasn't anyone back home. I was a student, and I moved here and I did everything I needed to do. So everything was fun and games until, life started taking shape. But I remember in Brazil, even when I was already in Australia going to visit you, and you had a physiotherapy clinic, PhysioClean,
Yeah.
in the heart of Porto Alegre, fully staffed. You were already on top of the game. And one day you made this change to just flip it all, move to Australia, start from the beginning. And I remember that the way you came here and you met with Ramon and myself, and you were very chilled and humble to just take this new approach. My recovery was not even a project.
No.
You know, like you just came to Australia thinking I'll do something different, something new, and the way I relate to that, you know, in my understanding is like in jiu-jitsu, sometimes you are in a good position. You are, you know, like you're about to catch, to submit someone, and you lose position. All of a sudden, now someone is on your back. You got a choke on your neck, and you got to get out. And you have that calm and understanding that, yeah, I'm in a horrible position now. Hopefully, I won't be here forever.
Yeah.
I just got to work through the next step so I can get one step ahead. Or sometimes we do lose a match. You know, we get defeated in a round or in a comp or in training multiple times.
Yeah.
We go there, tie our belt, tap hands, and we go again. And as long as we keep going again, we don't lose. You know, we gotta keep going.
Yeah.
And you had that transition in personal life. I wanted to see from you, like, how much of that your jiu-jitsu brain had an effect, because, you know, it was a big transition.
Yeah, it was a big transition, big transition. I remember, I don't know if it's my way to be. I get bored if I don't do something different every, let's say, 5 years. You know, at Mayo, for example, I want to break some walls, change the look. You know, change sometimes. I want to change like the way, the approach, the support, this and that. And I remember I was very good in Brazil, very full of people, full of patients there. I used to have like a group of physiotherapists that we used to teach together, work together. So money-wise was very nice, and I tick all the boxes in Brazil. I did the 2 graduations that I want. I was teaching. I was learning a lot.
Because you're a physio and a chiropractor,
And
right?
a chiro, yeah. I ended up doing the 2 graduations. Went to the physiotherapy graduation that I graduated in 2007, and then I decided to go for a chiropractic college there as well, and I graduated in 2011, and I didn't stop studying since then. And but at some point, not that my life got bored, it's just I want something different. And you guys were here, and Ramon went to Brazil once and started to
Sell the idea.
and start to chat with me, and man, come over. You can recognize your
degree.
here. You know Ramon.
Yeah, he's an expert of everything.
Yeah. So and then you're here, and I feel like if I have 2 guys there, they were my friends since Brazil, since we were like 6 years old. Or,
Yeah, 8, 7, yeah.
So let's go for it. And then in 6 months, I closed my life in Brazil, sold everything, reorganized. Because if you think too much, you don't do it. You know, let's do it. It was maybe my out layer was showing calmness,
Yeah.
but my inside layer was like
Poker face. The famous poker face.
pretty much. At the beginning was very stressful because you change the way that you've been seen. I started as a cleaner here, remember? I work as a cleaner from 4 a.m. till 7, then middle shift in the middle of the day, then teaching jiu-jitsu, treating some patients, and
Moving around to treat people.
around, yeah. So at some point, I thought, man, it's not for me. I'm gonna go back to Brazil. Do you remember? I bought some tickets to go to Bali, and then Bali to the Philippines. I went to do a dive master
Diving
there,
course, yeah.
and then went to go to United States to visit a friend of mine, and then go back, do like a kind of tour before I go back to Brazil. The day that I was supposed to fly to Bali, I didn't go. I just didn't go to the airport. I didn't cancel.
I didn't remember that part.
Yeah, I didn't cancel. I didn't do. I just wake up and feel, you know what? I'm not going. Not going. I used to treat a patient in Narrabeen, in Montevideo, and I used to cross Collaroy 7 a.m. Getting the sun like across the
Orange sun coming up,
amazing. and I start to think, am I going back to Porto Alegre? Not that Porto Alegre is bad, not, don't get me wrong. It's just,
But it's not like here.
it's not like here,
Yeah.
you know? So, no, Felipe, let's try a little bit more, you know? You're gonna give up too soon. And then I start, and I bought a book, a notebook, and I start to design Mayo. And
That's how you started designing My Recovery?
yeah, 2017. End of 2017, I decided to, you know what? How can I do to stay here? What can I do to design a nice brand or just the branding? And then what I'm gonna do until I recognize, until I validate the because I
Your
can
qualifications,
choose my
yeah.
qualifications, because I can choose physio or chiro. Luckily, I've got the two professions that I could choose, not just one. So I decided to go for chiro because physio, we have the cardiopulmonary part, the neurologic part, you know,
It's a longer process,
longer process.
lanky,
I never
harder.
studied that much. So
Yeah.
as soon as I graduate, I went straight to musculoskeletal problems.
Yeah.
You know, not like cardiopulmonary or elderly approach, or there's a bunch of areas that I never study.
Yeah.
And I had to restudy here, like being with 14 years of
Later.
experience, you know. Let's go for the chiro. Maybe it's gonna be easier. No, it wasn't easy. I did 9 exams.
Wow.
It was very hard, very stressful. I failed 3-4 times. And
That's the jiu-jitsu mind. Making decisions fast under pressure and
yeah, so it wasn't easy. It was super stressful. My son was born at the same time that was going for the exams.
yeah.
I failed. He got sick. We have to stay in the hospital. Then he got sick again because of the virus going to the child care.
Yeah.
It was a very hard. I wasn't sleeping well. Treating patients, studying. So remember I stopped training for a while.
Yeah.
You know, it wasn't like that.
Consistent
present.
anymore, yeah.
Yeah, so it was very, very hard. But I think the jiu-jitsu helped me to, man, calm down. You're in a bad situation, as you mentioned before.
Yeah.
Maybe
Tie your belt, go
tie your
again.
belt, let's,
Yeah.
That's, at some point you're gonna get
And
a
now,
good position.
coincidentally, I didn't know that part, but coincidentally, you live in
In
Collaroy,
Polaroid,
front of the beach. So every day you can get up and walk
That's
walk
it.
out of your apartment and see that
And
same
see-
sun that made you stay. That's pretty
that's
cool.
it, yeah.
You know, because that was I always when I talk to other people and friends, and sometimes we have many reasons why we believe people should do jiu-jitsu.
Yeah.
And but self-defense is spoken about, fine, but I feel that this part of mindset, resilience, making decisions under pressure, just dealing with adversity.
Yeah.
I feel that that's a super strong one, and often it manifests on things that we're not thinking. Like right now that we need.
That's true.
So like I remember your case being that the beginning of Mayo, and we brought it up. That you are a physiotherapist, and a chiro. And the two professions don't always agree with each other, right?
No,
The two fields.
not at all.
So one thing a curiosity that I have is, are there things that you believe work best on one side more than the other? And are there things in your own industry that you completely disagree?
Yeah, totally. For example, there is the classical chiropractic that uses one tool, that is manipulation, for every problem. I disagree with that. We have a bag of tools that, for example, you come to me and you're eligible to manipulation on your neck? Yes. Is there any risk for that? No, that's good. Or very minor risk. We're gonna apply manipulation. After that, I have to work with the muscle endurance. I have to teach you how to do. We have to test if you're doing properly. I'll give you some exercises to do. You have to understand what's the problem at the moment. We have a plan to set up. I cannot just use manipulation and see you later. There is a group of chiropractors, they just use that. There's a group physio as well, they just use that. So we have to classify the problem, and based on that, you open your bag, get the tools that you have to use in that problem, and based on that, you use them. You cannot just use one. Sometimes you're gonna use just one, education. Sometimes people, they need to be educated about their problems. So it's not a big issue. They're making the mistakes, you adjust that, and that's fine. So I think technique, it's important. Education, it's super important nowadays. Make people aware of their problems, because before used to be like, Felipe, that's my problem is yours, deal with that, do whatever you have to do, and give it back my
health.
Nowadays, that it doesn't work like that. We're a team, we have to work together. If we don't work together, probably we're not gonna get, maybe in some cases I can do something that you're gonna get pain-free, feel good, that's fine. But most of the time, that's not the case. We have to play as a team, especially in complex problems. So I think that's the way that I see chiro and physio. It's you cannot be very segmental in terms of technique. I think you have to have the tools. Based on the tools, you apply certain tools based on people's need. I think that's the difference.
And why there's then some treatments that feel good at the time, or are there, and if there are, why are there some treatments that make you feel good at the time, but don't resolve the problem?
Maybe because usually most of the time, all the techniques that we apply, they have short-term benefits. What makes you better throughout the whole plan, it's going back, consistency, and do whatever we plan you to do. Mobility, exercise, understand your problem. For example, people with back pain, sometimes when they have pain, what they do? They stretch. I need to feel that stretch. Let's use a way to describe it. Imagine if you're stretching and you have a cut there. You're gonna be open the cut all the time. Felipe, I've been stretching for 2 or 3 months and it's not going away, my pain. Maybe you open a little bit more the cut. The cut it's getting bigger, so the pain is increasing, you stretching and not getting better. So why we don't go to the opposite? Let's close the cut. Let's go backwards. Remember your treatment. So by the time that you're good then, we're gonna go to that position again. We're gonna bend forward.
But first you're gonna close the cut and take the other approach.
Exactly, it's like a scar tissue. You have to re-stretch the scar tissue, but after closing it. So it's just an example about how we deal with problems. And responding to you, we have acupuncture, super good in terms of result, or dry needling. You feel good, you feel great, you release the tissue. Massage, you feel great. Manipulation, you feel very great after the treatment. You feel good and release. But if you don't keep treating, it will come back. It's just a tool to create a window to exercise better, to mobility better, to move better. But you have to keep doing it, following the plan. Not just go there, get adjusted, or release a muscle, or put some needles, feel great, and finish. Especially for us that put the body in stress every week.
And one strong final question that I had for you is like, if any jiu-jitsu practitioner listening to us now, will there be one thing that they could start doing now to prevent injuries? And if there is, what is it? What would be your recommendation? Like, look, if you guys can do one thing, start doing this now.
I think there's 2 things. The first one is definitely go for some PT sessions or weight training or being active. Do weights. That's, for me, it's super important. The other one is have a do checkups with your physio, your chiro, go there. Do some checkups every 2 months, just to see if there's anything that could trigger an injury. It's that we could remove. That's something. I go to see someone every 2 months or every month or sometimes twice a month if I'm waking up my lower back, for example, in terms of injury. If my lower back start to play a little bit more,
You already address it.
yeah.
You don't wait until you're not moving.
Exactly. You know, that's something, especially over 40s, it's something that I'm doing more consistently. You know, be active in terms of weights. It's super important. Check on your mobility and do some checkups. That's, I think, it's the sequence of someone that is starting to go for jiu-jitsu now, and they will see the value, you know, over like a period of time. And then after that, they will recognize how good it is to be checked and keep doing the base of the treatment. We have some patients and clients and together, and they were not doing weights properly. They started to do weights properly. They got stronger. They trained well, but somehow they got injured. They treating. They doing the checkups now. They feeling way better doing the checkups and doing weights than not doing anything. You know.
Of course, yeah.
So it's, how do you feel when you go there?
$100 million.
Yeah, and
You
it
know?
lasts for a period of time,
Yeah.
and then
That's why you always pull in my ear, man.
and expires.
It's been so many weeks, you know.
Exactly, go there.
You're breaking yourself. I complain. I see you. Oh, my wrist, man. Oh, my back. Oh, my knees playing up again.
Yeah.
You know. But sometimes we're scared of hearing the truth. You know what I mean?
Yeah, but it's better to go there and manage than
Then pray for it to go away and keep the
Exactly.
injury. So, in short, most people wait until they are injured to care.
Yeah.
But the smart ones,
they go
prevent.
before. They prevent. Yeah.
Us.
Yeah.
Felippe, thank you very much for the lecture, for the chat. And
Pleasure
hope
to be
everyone
here.
enjoys listening to us.
Hope so.
Us. Say it to you boys. It's going to be a hit, a lecture.
That was good.
Good.
Yeah,
You
very
guys
good.
enjoyed it? Good. Thank you guys.
You got me wanting to reach out to you. Oh, niggling injuries.
Yeah.
Probably